Cancer clinics throughout the U.S. are now refusing thousands of Medicare patients in need of treatment. Doctors claim that the reduced funding for Medicare that took effect on April 1st make it impossible to afford costly chemotherapy drugs and remain in business. The only alternative for these patients is to look for treatment from another facility, such as a hospital. However, these facilities may not have the capacity to accommodate an influx of new patients. Congress meant to partially protect Medicare from the automatic spending cuts brought on by the sequester, limiting the program to only a 2% reduction, much smaller than cuts that other programs face. However, doctors claim that the cut is surprisingly devastating for cancer patients due to the way their treatments are covered. For seniors, medications are normally covered under the optional Medicare Part D, which includes private insurance. But since these drugs must be administered by a doctor, they fall under the umbrella of drugs paid for by Medicare Part B, which are subject to the spending cut. Under normal circumstances, the federal government pays oncologists for the average sales price of a chemotherapy drug, plus an additional 6% to cover the costs of storing and administering the medication. Because physicians have no control over the drug costs, they argue that the entire 2% cut would have to be taken out of the 6% overhead. That would equate to a double-digit pay cut. Cancer patients who are turned away from oncology clinics can seek treatment at hospitals that administer chemotherapy drugs. However, the care will come at a price. A study found that chemotherapy delivered in a hospital setting incurs an average $6,500 in additional annual costs compared to care delivered in a community clinic. It remains to be seen if hospitals have the capacity to handle this influx of additional patients. The majority of Medicare patients receive cancer treatment in a community clinic rather than a hospital.